I'm Antoni Chan, reporting here for RheumNow in Washington and ACR 2024. And today I have with me Professor Andrew Cope from London, who is the author of the APIPPRA study, who presented the data last year. But here at ACR 2024, there is a follow-up information on the APIPPRA study. So, Andrew, welcome.
Tony, it's good to be back.
So, tell us about the trial design for the APIPPRA study.
Yes, so APIPPRA was a randomized controlled trial of 213 at-risk individuals, so positive anti-CCP or ACPA, or together with arthralgia, and these were randomized to receive 1 year of abatacept or placebo, and then they were followed up for a year after that. And what we found and what we discussed with you guys last year was that on drug, there were very few events, very few people progressing to RA compared to placebo, where there were a substantial number, particularly over the first 6 months. And then when the drug was stopped, we saw a subset of people receiving abatacept progressing to RA, but by 24 months, there was still separation of the survival curves, really suggesting to us that there may be something else going on long term, and that prompted the follow-up.
So you followed up these patients, and what's the sort of outcome?
Yes, so we invited all of the APIPPRA study subjects to come back in for follow-up, and we managed to enroll 143 of those. And because there was a gap between APIPPRA and ALTO, there was a delay. And so some of the individuals who were recruited at the beginning of APIPPRA were followed up for almost 8 years. And then those who were the last enrolled in APIPPRA, we got at least 4 years of follow-up. So all of the 143 were followed up for at least 4 years in total. So that's 1 year treatment and 3 years of observation.
So some of these patients were high risk of developing rheumatoid arthritis. How did they do in the follow-up phase?
So the big surprise was that the separation of the survival curves persisted to just beyond 4 years, and we saw a statistical difference there. And what was interesting is when we looked particularly at the individuals who either had developed RA or 3 swollen joints or had started DMARD, the survival curves didn't converge for almost 5 years.
So looking at those with positive autoantibodies, what were their sort of clinical features?
Yeah, so the really striking thing was that those individuals with high titer anti-CCP or a more complex extended autoantibody profile were at much higher risk of progressing. That was true in APIPPRA and also in the ALTO follow-up. But the striking thing was that these individuals were also more sensitive to the abatacept treatment. So we have a high-risk progressor group, but who appear more responsive to drug. And we saw that extending out to 4 to 5 years.
And in terms of clinical features, either clinical exam or ultrasound, did you see any differences?
Yeah, we had a good look at that. So one of the things that identifies risk is, we do it in the clinic, the MCP joint squeeze. And it turns out that if you identify those who had tender MCP joints and had these high titer autoantibodies, their risk of progression was even higher. So that was one group. And then we did ultrasound at baseline and every 6 months during the APIPPRA study, not during ALTO. And those who had a PD score of 1 or more at baseline were much more likely to progress together with the extended serotype, whereas those who had no PD signal, and there were quite a lot of those individuals in APIPPRA, their progression rates were much less. So we've sort of the high risk phenotype is the joint pain, the autoantibodies, the distribution of joint pain, and the ultrasound scores.
That's very positive. So there you have it. That's the kind of longer term follow-up from the APIPPRA results, which was presented last year, and nice to see these patients continuing to respond long term. So Andy, thank you very much for your time today. This is Antoni Chan reporting from Washington for RheumNow at ACR 2024.